Hello, everybody. I want to bring something very important to your attention. It's an incredible opportunity for us to hopefully help us continue to get off-label access to oral vancomycin. So I'm really excited to share this with you. There is currently a bill that has a few co-sponsors that may help people with rare disease. So let me tell you a little bit about this bill and then what we are asking you guys to help us with. So this bill is called HR 6160, Access to Rare Indications Act of 2021. Essentially, in a small nutshell, what this bill currently does is provide an accelerated process for an appeal. So I know many of us have to go through this to access oral vancomycin, and essentially this bill will essentially create a pathway for people with rare disease to have an accelerated appeal process. Now, this is great. We know appeals can take a long time, so this is wonderful. However, I'm working with Cynthia, and we want to try to modify the language of this bill by working with our congressmen and women to modify the language to help out the PSC community even more. So what we want to do is modify the language of this bill to put the burden of proof on the insurance companies rather than the burden of proof being on us as the patients. So what I mean by this is right now, even if this bill passes and it creates an accelerated appeal process, we the patients still have the burden of proof, which means we're the ones that have to do all the research, provide the evidence, the research papers, the letters from our doctor, and provide that to our insurance company to explain why they should cover vancomycin for us. Whereas if we can get our congressmen and women to modify the language of this bill and put the burden of proof on the insurance companies, that could potentially be significantly more helpful to PSC patients winning these appeals, because it would be the insurance company that would have to be the one to provide the evidence, the proof, the research to justify why they're denying coverage of the medication. So what I'm going to do is record a second video where I can share my screen and show you guys step by step how to do this. Because what we are asking you guys to do is to contact your congressmen and women with a template. We've written the template. All you would need to do is copy and paste the template. So I'm going to show you how to do that, because the more co-sponsors we can get, especially if we can get co-sponsors throughout the states, that can really help progress this bill all the way through the process and get it passed, hopefully with the modified language. So stay tuned. I'm going to post a second video, but this is a great opportunity, and this is a high priority. We need to be working on this in case the AASLD guidance does get passed. So, all right, let me send you the instructions. Thank you, guys. Okay, before I send the instructions, I actually want to record another short video to go into detail a little bit more about the bill, so you can have kind of a big picture understanding of exactly why we want to modify the language. So currently for this bill, there are 4 pieces of criteria that rare disease communities need to meet at least one of these criteria to get the accelerated appeal process through this bill if this bill is passed. So I want to talk about those 4 pieces of criteria and how we as PSC patients taking oral vancomycin fit into those criteria. So the first one says that the FDA has approved this drug for the rare disease. So as you know, oral vancomycin is not FDA approved for PSC, so we currently do not meet this first criteria. The second criteria states that the drug is supported by clinical guidelines. So we do not meet this criteria either, assuming that the AASLD bans oral vancomycin in their guidance. The third criteria states that the drug is supported by peer-reviewed literature. So We may or may not qualify for this because yes, there are peer-reviewed literature out there that show vancomycin's efficacy for PSC. However, there is that one neutral Deneau paper which insurance companies could potentially use and use that to justify denying coverage of oral vancomycin. So this one's a bit tricky. We may or may not qualify for that one. But the fourth criteria we do qualify for because it states a medical expert identifies the drug as a treatment or management of the rare disease. So assuming that we have a physician that's prescribing us oral vancomycin off-label, we would qualify for this criteria. So as you can see, out of the four criteria, PSC patients only for sure qualify for one of these four. So if we can modify the language of this bill and get it passed with the modified language, it can hopefully increase our chances of winning these appeals. So yeah, wanted to give that insight to the bill. So now I'm going to record my screen and show you step by step what to do. Okay, thank you. Hey guys, so I want to share my screen and show you step by step how to contact your congressperson and ask them to co-sponsor this bill with the modified language. So this is the link to the bill. Now don't worry about writing down the URL, I'm going to send you the link, but this is what it looks like. And you'll see here there are different tabs. Right now we're under the text tab. And I encourage you to go through and read this bill. You'll see all the criteria that I talked about in the previous video listed in here. And then I just want to show you this really quick. If we toggle over to the co-sponsors tab, you can see that there are currently 5 Congress people sponsoring this bill. So, you know, that's okay. It's a small number. The bill technically could get passed with 5 co-sponsors, but to greatly increase the chances of it getting passed, we need a lot more. 50 co-sponsors is our goal, which I think we can definitely do. There are 50 of us who sent letters, so if each of us does this, we could easily get 50 co-sponsors. So in order to contact your congressperson, you're going to go up here. You can see my mouse. It says give feedback on this bill, and beneath it, it says contact your member. So you're going to click that, and it's going to make this little pop-up box come up. You're going to enter your zip code, and you're going to click on the name, and it will take you to this next tab. It says your possible members at the top, and then on the right hand side you'll see the people. Just keep in mind sometimes it does show people outside of your state. So I'm in Tennessee, but there are a few Georgia people here, so just be careful of that. But what you're going to do is you're going to contact each individual in your state. So we're going to start with number 1, and we're going to click the contact button. Now yours may look a little bit different depending on your individual, but it should take you to something similar to this where it says email me. So you're going to first fill out all this contact information here, and then message details is the important part. So you'll type the subject of your message, which we have provided for you in a document that I will send you. You're welcome to customize the subject line if you would like to, of course. And then the message section is where you're going to copy and paste the template that we have written for you. This template essentially gives a little bit of a background on oral vancomycin and includes the proposed modified language. So everything in there is everything that you need. You can simply copy and paste and hit submit. Now, of course, you can personalize this by adding a small paragraph about your personal experience with oral vancomycin. You could draw inspiration from the letter you sent to the AASLD and maybe provide a few benefits of taking vancomycin. It's always great to personalize these kinds of messages, but again, it's not necessary. We want this to be as simple and streamlined as possible. So you're welcome to, but it's not required. And then you're going to hit submit. Oh, just a quick note, this message box does have a limit of 5,000 characters. So our current template is about 4,500 characters. So if you do personalize it and add a paragraph, just be careful of the number of words that you're adding, characters that you're adding, because it will cut you off after 5,000. Oh yeah, so then the most important part about this is if you can please monitor your inbox and keep track if your Congress people respond to you, because Cynthia and I need to keep a running list of the people who respond, what exactly their responses are, so she and I can follow up with them individually. So please just forward any email responses you get from your Congress people. Okay, I have 40 seconds before this video cuts me off. Again, this is optional, but you can also call your Congress people's office. Your link may provide a call my office section. It's always great to include multiple forms of communication for things like this. Not necessary, but it's optional. Last thing I want to mention is if you just keep hitting actually no, if you keep hitting back, it won't take you back. So you need to contact each of your members. So go back to the bill, and then just go down the list and contact each individual person. Thank you guys for doing this.